Hi, my name is Michelle Mahoney. I'm a clinical skills practitioner at University Hospital Coventry in Warwickshire. Today I'm going to be demonstrating the skill of venepuncture and blood culture collection. So firstly, I would wash my hands using soap and water and the A-lift technique. I would then use gel as I come into my patient's bed space. I'm then going to identify my patient, checking the wristband with the patient and the blood form and checking that they're all correct. I'm then going to obtain informed consent, explaining the procedure thoroughly to the patient, explaining the reasons why we need to obtain a blood sample, and I'm going to discuss the cautions, contraindications and complications with the patient. I'm then going to check for allergies and ask the patient if they have any questions. Once I'm happy, I'm then going to go and collect my equipment. So after collecting all of my equipment, I've now returned to my patient's bed space and I would then gel my hands again. I will visually inspect the patient's arm and look for no obvious signs or any reasons why I shouldn't be using this limb here, and I'm quite happy that this looks okay. I'm then going to apply my apron. I'm going to take the tourniquet and pop this on the patient's arm. This will be approximately 10 centimetres above the potential puncture site. I should be able to get 2 fingers underneath the tourniquet and I should still be able to feel a radial pulse. I'm then going to palpate the area in which I wish to puncture. Okay, I'm happy that I've found a vein there, so I'm then going to remove the tourniquet as that can only stay on for a maximum of a minute. I just want to check with my patient before I take any blood that they're not on any medication that could mean that they would bleed more, and the patient is not on any coagulation, so I'm happy to proceed. Okay, I'm now going to prepare all of my equipment. So it's important that we protect the key parts that are going to come into contact with the patient. So I've opened my gauze and I've left it in the tray like that. I'm going to open up my wipes, and I will need 3 wipes. One for the patient's skin and one for each of the blood culture bottles. I'm going to pop my holder together. Again, this is a key part, so I'm not going to touch that. Put that straight into the holder, and the needle there has got a sheath on, which I'm going to keep on. I'm now going to put my gloves on. And I'm going to clean the patient's skin. So we use a cross-hatch technique for 30 seconds. Ensuring that we cover all of the potential area that we're about to use. We then leave that to dry. While that's drying, I'm going to clean my blood culture bottles. So we take the tops off. Take one wipe for one, ensuring that we clean all around the top and around the sides. Again, we do that for 30 seconds for each bottle. And the same with the pink one. Okay, we're now ready to go, so I'm going to reapply the tourniquet, check in again that it's not too tight and that it's 10 centimetres above. That's fine. Okay, it's important that you don't repalpate and touch this area again because you will contaminate it. So I'm going to take my butterfly needle, ensuring that the bevel is up like this. I'm going to hold the wings back. I'm then going to anchor the vein by stretching the skin. I'm going to warn the patient that there is going to be a sharp scratch coming soon, and insert the needle at 10 to 45 degree angle. Keep going until you see a run of blood along this part here. Okay, hold the wings down and then bring your blood culture bottles next to your patient, ensuring that they stay upright so there's no siphonage. Press that onto the top there and the blood culture bottle will fill. We need to make sure that we do blue first, which is the aerobic bottle, followed by the pink, which is the anaerobic. I'm going to take this off, remove my tourniquet because I've filled my first bottle, and then I'm going to invert this 6 to 8 times. Put that to the side. I'm then going to do the pink bottle. Okay, until that's completely filled up. Again, invert it 6 to 8 times. I'm then going to do my blood sample bottles, following the order of draw. It doesn't matter with these if they are inverted, it's just the blood culture bottles. And again, we fill these up and invert them 6 to 8 times as before. I'm then going to get some gauze and pop that over the puncture site, and I'm going to activate the safety device. So we pinch the bottom and withdraw the needle until we hear the click. You then apply pressure to the puncture site, dispose of your sharps, and apply pressure there for 2 minutes. Once you're happy that the blood flow has stopped, you then can apply some tape over on the gauze. I'm then going to take my gloves off. I'm going to fill in my blood culture bottles and my blood sample bottles, and I'm going to pop them in the blood form and send them off to the lab. I'm going to thank my patient, make sure that the patient is okay, and dispose of all of my waste. If it is just venipuncture that you are doing, you need to follow all the steps as previously demonstrated in the blood culture collection demo. However, there is different equipment that we use, and I'm going to demonstrate now how we would use that. So we have the quick shield here and the needle here. So this bit goes into the quick shield device and you screw it on. This is the safety device here, and you can position this however you want to. There is a black dot on the front there which indicates that where the bevel sits. Remove the sheath, anchor the vein as previously demonstrated. The angle is the same, so 10 to 45 degrees, and warn your patient. You will get a flashback of blood in the chamber at the front here to indicate that you are in the correct place. Once you have that flashback, you then stop and take your blood bottles and pop them into the device here. Push them on and they will fill. Again, invert them 6 to 8 times and remove your tourniquet after the first one. Ensure that you follow the order of draw that is appropriate to your local trust. Okay, you would have some gauze to pop over the insertion site. You withdraw your needle. To activate the safety device, you either use your thumb to press against the back here, or you use a hard surface until you heard the click. You then dispose of this in your sharps bin. You may also want to use a butterfly device like this one here, and that's perfectly fine. You might want to use this for people who have got fragile veins or are difficult to bleed. So I've just demonstrated the procedure using national and local policies to University Hospital Coventry in Warwickshire. Please remember to follow the policy of the local trust in which you are working. Thank you very much.